Hello, everybody. Welcome back to Nurses Uncorked. Nurse Erica doesn't know that I'm recording this intro by myself, but I wanted to report back based on those of you that watched last week's episode where we had a huddle news off, where we did a little competition to see who had the better stories, whose stories were the most informative and the most entertaining. And I just wanted to report back and say that hands down, I won overwhelmingly by 100%. One person even wrote in to say, "Sorry, Erica, but I'd say Jessica had the best topics in your podcast today, especially with the minimal amount of time she had to prepare. I love you both and love your podcast. Haven't missed one yet." Now let's get into this week's episode. I'm Nurse Jessica Seitz.
And I'm Nurse Erica.
And we're Nurses Uncorked,
the podcast that takes nursing facts
with nursing comedy and makes a little cocktail out of it.
Don't forget to hit that subscribe button wherever you listen to podcasts, and please rate, review, and download.
Hello, everybody. Welcome back to Nurses Uncorked. It's Nurse Jessica with Nurse Erica with her blinged up microphone. And we have a guest with us, my dear friend that I've known for a long time. We have Marla Barthen here, a fellow nurse. Welcome, Marla, to join us today.
Thank you guys for having me. It's great to get the gang back together.
Yes, feels like the old days. It does. Today's episode is going to be very informative. We are talking about nurses, and we're talking about hurricanes. We're going to update you on a lot of the things that have been happening with the hurricane season and how it's affected devastatingly so our communities and fellow nurses, hospitals, the medical community. And Marla has a lot of insight about that. So we're excited to dive into all of this and get you guys some information out there that you may not be aware of. Marla, well, let's just talk about who Marla is. I'm going to read your little bio here, Marla, so people kind of know who my friend here is. Marla's nursing career spans 3 decades. She started nursing when she was 5 years old, and just I hate when we have to say that, how long we've been a nurse.
Thank you so much. I appreciate it.
You're welcome. You're welcome. Includes critical care, education, management, and community nursing. Originally from Columbus, Ohio, she now resides in Wilmington, North Carolina. Marla serves on several local and state nonprofits. A lot of people know her. She's very active in North Carolina. I know that. Most of her advocacy work centers on support for nurses, gender equality issues, reproductive justice, Medicaid expansion, elder care, and racial equity. She currently works in the TV film industry and as a medic RN, not as a porn star. People, don't get your minds out of the gutter. She's doing nursing film television. As a member of the New Hanover County Resilience Task Force and Wilmington Response, she's helping her state in the Hurricane Helene recovery, which is what we're really going to dive into today. So, Marla, what are you currently doing since you've graduated from the film industry? What are you?
Well, I still am active with the film industry, but I am in the middle of getting my insurance licensure. I feel like, it's very interesting, with flood and hurricanes and things like that. But I really was interested in the long-term care portion of that and the health insurance industry, as we all know. I know Erica talks about it a lot, about health insurance and how we can get outside of our employers to make sure that we have something that's a little bit more portable and economical for us. So anyway, that's what I'm transitioning to. So I'm in the middle of studying for my exams, but I will still continue to support our film community here as well. But I've been part of Wilmington Response, which has been around since Hurricane Katrina. And I've been part of the New Hanover County Resiliency Task Force, which is more about mental health resiliency. And this was something that was born out of Hurricane Florence that affected the Wilmington area in 2018. So I've been part of them for a long time as well, so pretty much since their inception. So we are I don't know if you guys saw this, but we just had our a unnamed tropical storm that came through my area 3 weeks ago. So that did a lot of damage in Brunswick County and New Hanover County, where I live down at Carolina Beach. So
Oh, that I'm sure is just the start of the beginning of a lot more stuff that has gone on.
it is, but we're very
Yeah.
well prepared. We do, obviously. I mean, you live in Florida, so you know hurricane preparedness. If you live in these areas, you kind of understand what it is, and you prepare for it all the time. And it's the back of our hand. But for folks over in Western North Carolina, they are not prepared for this, and they don't have the infrastructure like we did.
Well, I will say one thing that Floridians do prepare for in a hurricane is a drink. So we're going to get into our drink of the week because when we get ready for a hurricane, we have a hurricane party. That's just the way that it goes. You get your supplies, you get serious, but you get a lot of people like to get their alcohol in hand. So we're
Same.
gonna yeah, we're gonna do our drink of the week. Erica and I, like we said before, went to Hawaii and we had tons of drinks in Hawaii. So while we're not drinking right now because it's early in the day, I'm going to tell you all about a fun drink that we did have in Hawaii. And I will show for those of you watching on video, you can see the lovely beverage that I partaked in. It was called, I
Beautiful.
don't even know how to pronounce this, but it was a Ka'awa cherry bomb, Kaawa. Is a lot of A's in there. Cherry
It's
bomb, and it was
Hawaiian.
so yeah. It's Hawaiian. I know I'm saying it wrong, but the center of it was a big ball of ice, as you can see in the picture,
It's
and
huge, like a
it's called
tennis
a
ball.
hibiscus ball. Yeah, it's like a big ice tennis ball, and it's this beautiful red drink. It's mixed with your choice of vodka or gin, lemon juice, honey. God, this sounds good. I want another
It's
one.
so good.
And cherry bitter, but it was so good. We thoroughly enjoyed it, and we were happy to try this for you guys. It was tough, but
It's hard work.
we managed. Yeah, we managed through. So
Yeah.
we'll have the description of the ingredients, and I'm sure you can find the exact amounts to put in it if you Google it online. Maybe if we have time, I'll try to figure that out for you guys. But yeah, the Kaua'a cherry bomb.
If you watched our recent episode some weeks back at the rally in Ohio for Tristan Kate
Oh
Smith,
yeah.
Marla was one of the speakers there that day, did an outstanding job. And also for faithful listeners that might remember episode 27 and 28, where we discussed the National Nurses March. We mentioned
Yeah,
Marla a
yeah.
couple of times during that because you were also
Because
very, very integral into that hot mess. And so just a little context there. So you have been in and around a lot of the current events and issues that we have been discussing for quite some time. And if, side note, if you want to come back on and ever give us your version of the National Nurses March and that debacle
we'd
in
love to have you.
DC,
The follow-up,
we would
sure.
love to do a part 3 one day.
Sure. Still
Yeah.
have PTSD from that one, but yeah.
Oh
yeah,
yeah,
I could do
I
it.
think we all do.
I'll
Yeah.
be drinking
Yeah.
for that.
We'll do that as an evening recording, and we'll
With
we'll
lots
cut
of
loose with with
Mhm.
that one. So
Yeah.
Marla is it? Yeah, like I said, Marla's a good friend, and we go way back. She saved a lot of the march. She helped tremendously. Basically, ran the show, but that's a whole nother episode. So take it away, Erica. Let's talk hurricanes.
Yeah, so as everybody knows, Hurricane Helene has just been catastrophic for many
Mm.
areas and many unanticipated areas like North Carolina, where my understanding is they don't get hurricanes, right? In Kentucky, North Carolina, or not very often. Correct me if I'm wrong. I'm a California West Coast girl, so hurricanes are not my area of expertise at all. I wouldn't even know what to do. But it has been catastrophic for many areas. And I've been hearing from nurses from day one saying, all we're hearing about is Florida on the news. That's all anyone is talking about. And we are devastated in other areas. And so one example that has gotten very little attention was in Irwin, Tennessee. So on September 27th, at the height of Hurricane Helene. at Unicoi County Memorial Hospital in Irwin, Tennessee. This is a 10-bed inpatient bed critical access hospital, but a full hospital with a full ED, all of the imaging services, everything. They were flooded and trapped inside of this hospital. And the employees at one point had to evacuate to the roof because there was nowhere else. They could not be reached by land. There was nowhere else to go. And so they evacuated the patients and the staff to the roof of the hospital. And there was about 54 people in total there. And eventually they had to be evacuated by 2 Black Hawk helicopters and 2 state police helicopters. And so thankfully they were able to evacuate safely, as far as I know, all of the patients that have been transferred to a nearby medical center, and safely evacuate the staff as well. And currently they are temporarily closed due to the flooding. But can you imagine being a nurse in a hospital during a natural disaster in that exact area? First of all, is terrifying enough. I've never been in that situation, knock on wood. But to have to evacuate, and then to evacuate to the roof, there's nowhere else to go. And then to be rescued by a helicopter.
So scary.
I cannot. Oh my God, that must have been terrifying.
No, I seriously, I can't imagine. Like, it sounds so scary to have these patients like dependent on you, and you're trying to get them to safety, but you're scared yourself. You don't know what's going to happen. And for this
Yes.
to come, like, not that they didn't know that there was a hurricane coming through, but to kind of answer your question from before, Erica, like, for those states to get hit in this way, where it comes already across Florida, through Georgia, like, where usually it has time to slow down as opposed to kind of coming up off the other coast. It gives a sense of like you can kind of relax a little bit. Like, there might be a lot of rain and wind, but it's not in the sense that you have your guard up so much that you think that there's going to be torrential flooding. Like, so I think that's kind
Yeah.
of, would you agree with that, Marla? Like, that's kind of
Yeah.
where they were caught off guard.
Well, I live on the coast, and so for
Yeah.
us, we actually evacuate to Western North Carolina
Okay.
because of elevation. I mean, it's the
Interesting.
mountains, it's the Appalachian Mountains.
Yeah.
So that's where we go. And so you think of elevation as something as a safety piece of that, but the amount of water that dumped, it's mudslides. It's huge mudslides. And honestly, the death toll is going to be staggering.
Yeah. This
I have
particular
more
hospital
information on
was
that
in the
whenever you're ready.
Appalachian Mountains. And I do want to point out that the Tennessee Board of Nursing has a link on their homepage on the website, tn.gov, for donations and information. And we're going to give some more resources at the end. But a success story in that they were rescued, but
Thank
terrifying.
goodness.
And I
Yeah.
just wanted to point out, like, there's so many other places that have been devastated by this. And if any of the staff there at that Unicoi County Memorial Hospital, when the dust settles, if you want to come on the podcast and share the story with us, we would love to have you. But Marlo, can you tell us a little bit about what you're hearing and seeing?
Well, I will tell you, you talked about a critical access hospital, which was what was in Irwin, Tennessee. Same in Polk County. We had 2 nurses and a doctor that held it down in Polk County. 2 nurses and a doctor. They had a CAT scan machine. They couldn't read any of the results of anything, but
Wow.
these 2 nurses and a doctor did it all down. And so you think about Western North Carolina. Most people are probably familiar with Asheville, where the Biltmore Estate is, which is a
Mm-hmm.
huge tourism part of town. It's also very a lot of artist community and things. A lot of infrastructure. Very beautiful part of our state. But surrounding Asheville, you're talking about counties that don't have the same kind of means. They're not wealthy counties. And so while we have infrastructure, it was just quickly disabled with communication. Cell towers are down. We had 4 wastewater treatment plants that went down. Don't know when those are going to be back up. And of course, I think you guys, we always talk, I'm a union person. You guys are union folks too and understand unions well. So we all talk about Mission Hospital, which is what we're familiar with, which is an HCA hospital. Those folks at Mission, those nurses are very traumatized. I mean, they don't have running water. From what I'm understanding, they still can't flush their toilets.
Oh
and
my gosh.
it smells like feces throughout the whole
I'm
hospital. Sure. Their ER was overwhelmed, which normally holds 100 people, but at one point they had like 400 in their waiting room.
Wow.
Crazy area. So, I mean, you're basically overwhelming resources all at once. And part of, I think, the criticism that comes into it, you think about us when we had Hurricane Florence, my county became an island. And so if you think about Western North Carolina, the vastness of that area, they're all an island. And so, yes, we're starting to get resources in there, which is something that's been challenging. But we have to use smaller helicopters, even military helicopters. It was difficult because, you can't land them in some of the spaces. So we've had a lot of private airplane or helicopter pilots that have come in to help us. We have Operation Airdrop that's been very active. Wilmington Response, of course, we have helicopters that we've contracted with as far as it was Hurricane Helene response, it was another airlift one that we contracted with and are partnering with. And of course, we have like our Cape Fear folks our volunteer base that's here. So like I said, we've deployed for Katrina, Harvey, and when we talk about mainland North America with hurricane devastation, Katrina was almost 1,400 people that had died between Louisiana and Mississippi, I believe. So pretty large. And of course, Hurricane Maria down in Puerto Rico was almost twice that, somewhere in that area. And you're hearing on the news that we've got death tolls, I think as of today, 200 and some, 225, do something.
That's what they're saying.
That's not accurate. That's just what we're still in a search and rescue phase, and people don't understand that, the differential of that. So we're 10 days out and we're still doing search and rescue. Because of that means we're not collecting the dead bodies. So we had, from our area here in Wilmington, we had North Carolina Task Force 11 that was out doing their training ops, and then they were there as first responders during the whole piece. I mean, they saved countless people, countless. It was like swift water rescue. They are a tough bunch of crew there that is in with the North Carolina Task Force 11. So they were already boots on the ground. So they came back on Tuesday, and then by Wednesday, we sent out the next rotation. And on that rotation, we sent out 1,000 body bags per the request.
1,000 body bags
1,000
were requested.
So we sent out 1,000. Yeah.
And yet in the mainstream media, they're giving us a death toll in the 200s.
So far,
because we can't pick up those bodies yet. And you're seeing horrific things on TikTok and other social media where people are crying about dead bodies that have washed up and, opening up their front doors, and there's dead bodies on their lawns, things like that.
Can you imagine?
That is true. That is happening. And at this stage, though, we're at survival mode for folks. We don't have water for them. We don't have food for them. We don't have necessary medical supplies. So, and we can't reach a lot of them. We're using mules. So, I mean, God bless.
I saw that. The mules, they're literally putting supplies on mules to get them in to these isolated areas. And then there's people that are insulin dependent, and they are airdropping in insulin because they literally cannot physically access that area.
Yeah, our team did that yesterday. Yeah, we did airdrops on medical supplies yesterday.
Is this because there's still water, or is it because of devastation from debris and roads?
There's no roads.
There's no roads.
There's no
Okay. Like I'm
roads.
trying to
There's no
get an
roads.
understanding. It's just all
Yeah.
washed
Bridges have been
away.
washed away, roads. Yeah,
Yeah, it's
unbelievable.
completely the entire infrastructure of that is what's down. So you
Okay.
think communication towers. So even with our team, so today's Sunday. So Friday, we lost contact with our team for 10 hours. And
Oh
so
my
we sent
gosh.
physicians, assistants, nurse practitioners, and nurses. And of course, we had, folks with chainsaws and things like that we sent out as well. So we packed up and deployed on Thursday. That was the first time we had a team out. We sent trucks and things like that ahead. But that's
Hmm.
the other part is there's no place to store anything.
Right.
So even, we appreciate all the things that people want to donate and give, but you really need to not self-deploy because there's no place for you to stay. There's no, you have to figure this all out for
And so
yourself. So
when you
we
say
really want people
self-deploy, can you explain that to
pack up
people?
pack up your car and go. Like that's not something that is going to be a smart idea. It's something that every community has been discouraging you from doing because you need to be connected with a volunteer organization that assists with disasters, a VOD. You need to be with a VOD. And for us, like we had to register with our business emergency operations center. And when we deployed, we had, from Wilmington is normally like a 5.5 hour drive for us to get to Western North Carolina. Took them over 10 hours with stops. We had a police escort, things like that the entire
Wow.
way. So to come into those areas, it's the other thing I think that is very discouraging is hearing folks doing disaster tourism. We don't
Oh
we
my
don't need you on the
God.
road for that.
That's a thing? Like right
They
now
want
in
to
the
see
midst
the
of it?
devastation.
How?
Oh,
How are they even doing that?
They are getting by on some secondary roads. I mean, for all
That's
intents and
disgusting. I
purposes,
did not know that.
yeah,
it does
yeah,
not surprise me, actually.
yeah. We
They
need to
probably want to
not be
see it.
doing
Yeah,
that.
they're just curious and want to see it with their own eyes. But that
Right.
doesn't help either. They need less people on the roads that don't need to be on the roads.
I'm
Right.
very grateful though that social media is good at censoring photos of dead bodies and things like that. That's not something that we need on the news or
No.
in social media world right now.
Well, and I think
Yeah, because
without
I think
social media, we wouldn't know the devastation in places like North Carolina because it's not being reported on very much.
I
Or when it
know
is, it's
it's true.
just Asheville and not any of the outlying areas.
We have communities that are gone, that are no longer on the map. They're
Hmm.
gone.
Yeah.
So, yeah, I appreciate Asheville and everything Asheville is to us. We love that it is the surrounding areas as well. So, when we deployed, we were in Spruce Pine, we were in Beech Mountain, Sugar Mountain, and Hendersonville. And that's where we were assigned, essentially. So, we sent out our first team. And then the night before we left, thank God we have good communications with North Carolina Task Force 11. They were letting us know that because now we're so many days out from all the rain and all the mudslides, that we obviously can't pick up the dead bodies of humans and also from animals, but we have a lot of toxins. So now our first responders are starting to get ill. So we had
Oh
to
my
outfit
Okay,
everybody
gosh.
with
can you
Tyvek
explain
suits.
that to us? What kind of toxins are we talking about?
Well, you have industrial waste that's come
Okay.
down. This is a manufacturing area. We have all the
Okay.
different toxins from that, but you also have bacteria and waterborne illnesses that are now going to be starting and have started already. So, and of course, decomposing bodies are
Right.
going to give you more toxins in the water. So, just being out there in it, trying to muck out things and try to get to people, you have muck out boots, but on there you have a Tyvek suit underneath, and you've got duct tape around the ankles and the wrist, for your gloves, so that you can contain yourself. So basically, it looks like a hazmat situation for us. Because we've got skin rashes and other infections that are happening, just rashes, things from being in the water too long.
Hmm.
So the illnesses are coming, which means all those folks that are stranded out there, they don't have Tyvek suits and they're out there
Oh my
mucking out their own
gosh.
houses, and they're in the,
Mm.
you see them, there's the shovels of just mud. They're just digging themselves out, their
Oh my
communities.
gosh.
So that is that. So we have our first week response, and now we're in the second week response.
Okay.
So our team will come back later today, and then we'll send out a new team. So this is a constant rotation for us. And I will say, I heard you mention that Tennessee, the Board of Nursing has links and things on theirs. North
Yes.
Carolina as well. Governor Cooper
Yes. Yes.
had issued, our state of emergency. So we are under an emergency waiver. So you can come from other states to come help us as nurses. And then also we have our emergency waiver piece that's going to go out all the way till the end of December. So if you want to get a temporary nursing license and kind of help with Mission Hospital or some of these critical access hospitals that needs to rotate their staff out, or
Do they
we're
need
going to
a
need help for a long
compact
time.
license?
You do not need a compact
Oh,
license
okay.
because we're under emergency orders. So
Okay.
I will make sure you have the link for this later.
Yeah.
And we also have a frequently asked questions page about Hurricane Helene on our Board of Nursing site that can tell
Okay.
you what you can do and what you cannot do. So we
Okay.
still, so if you come under emergency order right now without getting your temporary license here, or if you don't have a compact license, you can still come, but you need to come with an organization. So this is why I keep saying with an organization,
Don't just come
organization.
Don't
yourself.
just show
Yeah.
So
up
yeah,
with your
you can come with
stethoscope.
Wilmington Response. We have a volunteer. Yeah, please don't just come. Yeah, and plus people don't understand the difference between what you can do inside a hospital, which is, all of our nurses that we've done COVID together, right? So we understand that part of that. That's not what this is. I mean, yes, you have facility nursing, but then you have all this community and outlying areas. So if you've had wilderness training, always appreciate that.
Mm-hmm.
Always appreciate those old camp nurses. They're not, I say old, folks with camp nursing experience.
I did camp
who know
nursing
what
for
it's
a
like.
long time. Yeah.
Me too. I loved
I
it.
love
I
it.
loved it. So yeah, some of those other experiences, you need to outfit your own self. You're coming with your hiking boots and your muck out boots.
Mm-hmm.
You need to make sure that you have your own sunscreen and your own bug spray and your
Right.
liquid IV and all the stuff to be able to. You can't become a casualty. We can't afford for you to become a
Right.
casualty. So, and you also, you guys know me well, so you know that I have rheumatoid arthritis. So normally I would deploy, but I didn't even deploy for this one. I outfitted everything that I have from my film work that I do. I probably sent $1,000 worth of equipment and supplies with the team to
That's
go
awesome.
because I knew that I couldn't physically do the job. And that's a very hard place to be, thinking that I
But
had
you're
the
doing your
expertise
part.
and the knowledge. So
Exactly.
what I'm
That's what I
doing
told you. Yeah.
is coming
You're
back, or staying back here and making sure that we're sourcing things. One of the things people I've heard, and I am following up on some of the nursing stuff that's happening in the nursing chats, I am a little disappointed sometimes when I hear everybody talking about, the IV shortage, Baxter.
Well, I was going to ask
manufacturing.
about that. Okay. So there is a Baxter plant
It's
in North
the main
Carolina,
one.
correct?
Mhm,
The
mhm.
main one. And so there has been a lot of talk of telling nurses and the medical community to expect IV fluid shortages. So do you have more information
100%.
on that?
Yeah, that plant was in Marion, North Carolina, which is about 35 minutes of Asheville as our point of reference, I guess is what we're going to keep saying, Asheville, but 35 minutes from there. And that, luckily, we had no loss of life there as we did at some of the other plants where people who own those plants had their workers still working right up until everything hit. At least Baxter evacuated everybody, which was great. But it's full of mud. It's full of mud. So they are out of commission. They are working on it. Ancillary answers to all of that. But now we have a nationwide IV shortage that is real. And so we've been having trouble sourcing IVs. So I have been busy the last 4 days now sourcing IVs. I'm actually up into Washington, D.C., and I have a courier coming down from D.C. through Virginia and picking up IV supplies from hydration companies.
Mm-hmm.
The self-employed or those companies
Yeah,
that
the
are doing it
ones
for when
going
you're
around for
hungover.
hangovers. That's not a priority
Yeah.
right now.
So, so we're asking
Yeah,
our
no.
The ones that
hangover
are
Ivy
working
to.
P. Diddy's parties, that's not a
Yeah.
priority right now.
So
No, not at the moment.
there
No.
are people who want to help, which is great. And so I've had a great response with doing that. The other thing that we're missing is we're having issues with our EpiPen sourcing.
Oh,
Direct
really?
Relief did source us 2,000 for North Carolina EpiPens.
Okay.
The problem is that now you've displaced all the bees. And so we've had all these stinging insects, not just bees, stinging insects
Oh. I'm like, where
that
is
we've
she
had
going with
trouble
the
with.
bees? Okay, it took me a minute to connect the
We're out
dots.
of EpiPens
Yeah, yeah,
because
yeah.
it's not just people that are displaced; it's also everything. It's you have to think of all
Yeah,
the wildlife
Oh
that's
my
displaced.
gosh. You just don't, there's so many
I
tiny
would
things that
not
you
have
just don't.
thought of that. Wow.
What I was going to add earlier was, I think what we were saying, obviously the death toll is probably going to be, we know it's going to be more than what it is right now, but a lot of people aren't focusing on how many people that are still missing. So if you look, at the numbers, the missing people, I mean, at least from what I've seen last time, I think it was like 700 that are documented missing people. Um, those that's the kind of part you need to understand is obviously these people are still missing for a reason, but they just haven't been able to get to that part of the mission yet to be able to start recovering those bodies. So unfortunately, I think a lot of those missing people will end up being part of the death toll, unfortunately. But
Yeah, we
Yeah.
anticipated for our team to be, bring us your injured and bring the people to us because we had different staging areas.
Mm-hmm.
But then a day and a half before, they said, no, we could use your team for search and rescue too. And so that's what they've been doing. We were able to find a family. We located kind of a community of folks that have pulled together 200 that we were able to get in there and help and connect to resources. Again, people don't know what's happening at all. That if it happened to you, you're not necessarily connecting to anything because you're not, you don't have a power source. We're to the point now where people have crawled up on top of their roofs and done SOSs for us.
Jessica, you were tracking one of the searches for a
story.
nurse, right?
Yeah, I did want to. Yeah, I kind of wanted to highlight one of these people that I had been following just to kind of put into perspective. I mean, obviously, any loss of life during this is awful, and my heart goes out to anyone, their families that have lost or that their loved one is still missing. But I figured I would highlight this nurse because this is a nursing podcast, and this just is a gentleman that shows how heroic he was and how heroic nurses are. Um, this was an RN that worked at Greenville Community Hospital. His name was Boone McCrae, 32 years old. And when the hurricane hit and came through, obviously there was a lot of water rising, um, flood waters. He had a boat, so he figured he would try to go and help. So him and a female, which is a friend of his, and his dog, his beloved dog, all got on the boat together to try to see if they could go and rescue some people. Unfortunately, when another rush of the flash flood waters came, it shoved the boat into like a sidewall, and it caused the boat to capsize. It flipped over. In reading more, the female that was on the boat was able to get rescued, but at that time, Boone and his dog were caught up into the current and the water, and were missing for days. Um, they found the dog about a day and a half later, and the dog had passed away. And they were still holding out hope and searching. And I was following this story and following and things on their Facebook page, and they did unfortunately find Boone's body just the other day. So he did unfortunately pass away. But I thought it was important to highlight this not only because it's one of our own, but this is just one story of
Hmm.
hundreds, maybe even upward of 1,000 or more that um, this is going to get me teary eyed that
Hmm.
have gone through this, not expecting it, not expecting that they're going to be one of the ones that are caught up in it and lose their life. And it also just really highlights his heroism and how he was not thinking about himself and was just trying to get other people help. So my heart goes out to him and his family
And his
and all
dog.
his
I
nurses and
can't.
everybody at the hospital
Yeah.
that are missing him. They said he was a beloved coworker, that he lit up the room, and he would always sing to his coworkers when they were stressed or going through bad days. That he had this way about him of he would just come in and sing for everybody, and that it would always cheer everybody up. So that's how they're remembering Boone.
Yeah.
Thank you for sharing that.
Oh my
That was
gosh.
yesterday, our beloved Asheville group. We've had them, so we drop, we don't even know what's wrong. We just get there. So we actually have
Yeah.
to have our smaller helicopters get to them. And that's how we're finding them, as they're putting messages on the roof. Hmm.
What's the whole like Starlink thing that there is that like a way to access
Yeah.
Wi-Fi or something
Yeah.
that they're
Because
they're
it's
dropping
satellite.
into people? Is it okay? I don't know how that works.
Yeah, Starlink is satellite, so we need sat
Okay.
phones. And I know that some of the newer phone models are supposed to have some satellite linked up capability too. But these folks didn't even have their phones.
Mm.
Oh,
They
yeah.
were getting out with just nothing.
Right.
I mean, I'm sure you've seen those stories where people are climbing up mountains, watching
Yeah.
their house and their neighbors be
Yeah.
swept down. They don't
Yeah.
have anything like
They were
that.
just wholly unprepared. I mean, it was not expected to hit those areas, and these are areas that are not normally affected. And so they were just kind of going about their lives, not having the luxury of kind of advance notice, right? Like maybe Florida does. So really, really caught off guard.
Well, there's some interesting pieces in there too, because I mean, you guys talk about insurance a lot, and I'll dip into there just for a second. You're looking at flood insurance for Western North Carolina, maybe about 2.5% of the people that had flood insurance,
Oh my gosh.
but they don't have earth movement insurance. Which you're out west, you
Earthquake.
understand earthquake insurance, right? And then
Okay.
in Florida, we understand sinkholes, but
Hmm.
Yeah.
but mudslides are earth movement. That's earth
Mm,
So
movement.
yeah, so
that's
basically you're just not
considered
covered
Earth movement.
Earth movement. Yeah.
Oh, I didn't know that.
So these
Yeah,
folks,
I've always
A,
wondered
aren't
about
prepared.
that. So in Las Vegas, we have flash floods. Okay, you cannot get flood insurance out here, like to save your life. What
because
is
they
that?
know it's
Seems
going to
like
happen
that
routinely.
seems
Yeah.
like such a conspiracy. Like, what do you? I understand it's probably going to cost more. It's going to be like a rider on a regular insurance, but why can you not get it at all?
Yeah. Yeah.
I
Because
It's
they
don't
don't want to
understand
be
that.
responsible because they know they'll have to pay out.
it's
They
it's a
know
loss. Well, even for us. So you guys know that I was in Hurricane Florence here in Wilmington, and we lost our home. And we had insurance, but you always have an extra deductible for a named storm. So you have your regular deductible, and then you have like another premium for these catastrophic events. So yeah, I mean, we've gone through it too. And even though you have insurance, it's not enough insurance. It doesn't keep up with
Right.
the inflation of it all, right? And so
Yeah.
even for us to rebuild, we had such a difficult time with how much everything went up in cost to rebuild, because wood and all those costs, all the material costs went up so high. So it doesn't cover enough. It doesn't cover enough. And so if you can imagine what it's going to be like for those folks there. We are 6 years out from Hurricane Florence, and we're still in a different house from our original house. So I'm just telling you that for Western North Carolina, you're going to have, it'll be a decade before, you see people looking even remotely what they looked
Did
like
you
before.
evacuate during Florence or?
We did, and
Okay, good.
we evacuated, and we couldn't get back for 10 days. So, even though this storm didn't hit me, and if you live in these areas, you kind of understand this one might not get you. And I know, Jess, you were filming um, your own hurricane experience down in Florida,
Yeah,
and
right.
I know you took some flack you know, for the minimal damage that you got. But just because one doesn't get you doesn't mean another one won't. And
Well,
so
I
we
think
understand
Absolutely.
that.
Jessica jinxed herself, maybe.
I did. I last week on the podcast, had said that, it kind of living right here in the Tampa Bay area, like we literally, I was looking at the statistics. We have not had a direct hit since 1921. That was the
Wow.
last storm to come directly and hit the Tampa Bay area. So I was telling Erica on the podcast, a lot of times you just feel like it's like somebody calling your bluff, like, oh, it's time to get prepared, and you start to become complacent, I guess, a little bit because you
Hmm.
just don't feel like anything major is really going to happen. And we've been lucky, like honestly, this area, they say like we have that the Indians blessed the Tampa Bay area. There's this whole I mean it's a true thing, but they're saying, that's why we've been taken care of, and the hurricanes kind of go one way or the other of the Tampa Bay area. But now, of course, out of nowhere, we have grumpy old Hurricane Milton has formed, and lo and behold,
Damn it,
appears to. So
Milton.
we're filming this today. We're on a Sunday,
The
and
6th of October.
This will come out on Tuesday, and Milton should be,
Monday
if
for our
continued,
patrons.
yes, Monday for our patrons. If you'd like to be a patron, you can check that out on the description of the video. But having that said, when this podcast does come out Tuesday, Milton should be coming through later tonight into tomorrow morning. And the track has it as a 3 to 4. Some models are saying possibly a category 5. And I am actually scared this time. I'm
That scares me that you're
scared.
scared because you
I
always
know because I
are
don't
not
ever
too
get scared.
concerned. Yeah.
My father used to always say, if a hurricane comes through right through Tampa Bay, it will be devastating. People don't understand. I mean, because it's just this little bay, and that water has nowhere to go. Like you get a storm surge on that back end, and that water has to go somewhere. And I mean, you're talking uh 10 to 15, sometimes 20 feet storm surge. And it's going to be devastating, especially for people right on the coastline. Um, I'm I'm worried. I mean, I live in Palm Harbor. Um, we're we're in a B evacuation, so we're not the first ones to have to go. We're second. I live right like on a lake actually. Um, but to hear all of that, and to hear like meteorologists talking and saying like, you guys don't understand, like if this hits the way it's saying, like it's and I'm like, people haven't even recovered from the first hurricane coming through.
Mm-mm.
There's debris all over the streets still here in Florida that the trucks
Mhm.
haven't been able to pick up. I mean, there's literally rotted wood, furniture, chairs, I mean, that are just lining people's roads. And now you've got another strong, serious hurricane coming through. All that stuff's it's going to be, I don't
Are
even
you
know.
going to
It's going to be a hot
evacuate?
mess.
I think you need
We're
to
waiting to hear
evacuate.
what they say for sure. But if we're told that we need to evacuate, then we will evacuate. It's just I understand how people feel because being in this position, you start thinking about your dogs and your cat, and I understand they're animals, and but there's a lot of things to take into consideration. So we're gonna do what we need to do, and we're preparing. Today there's been a whole day of preparing, which we'll have to continue to do, but that'll be something to watch. So yes, I think I jinxed myself. Now we're going to take a moment to hear a word from our sponsors.
I think we may have found a new use for stink bomb odor blocker. Talking about all the search and recovery efforts with the hurricane, one of the challenges that they face is an overwhelming stench when they're out there. And stink bomb odor blocker would be really helpful to just put under their nose when they're out there doing that.
Yeah. I love Stink Bomb. It's an amazing little product. If you've never seen it before, it just looks like a little lip balm. It's discreet and it comes in so many amazing scents. Just this week, I was actually sent a new pack and it's got all sorts of different smells. It's their happy hour scent collection and it's got some of the favorite drinks like Moscow Mule, Pina Colada. But it's such an
Mm.
amazing idea developed by an actual nurse. You can go to stinkbombodor.com and shop and use code uncorked15 for 15% off. All right, we're back with Marla. And before we continue this week's topic about hurricanes, we're going to do a problem of the week.
Problem of the week.
That was sent in to us actually just this week. I got a message from a nurse, and this is her question. So, Marla, you chime in too and let us know if you have some suggestions.
Sure.
I have a problem of the week. I started a contract with a nursing home. I found out 2 days after I started that there was Legionnaires in the water. After I had
Ooh.
drank the water for 2 days. Is there
Ooh.
anything I can do? I have reported it to my agency, but don't know if there's anything else that I should do about it.
Well,
Wow.
it
This is
needs to. Well, okay. So let's start for those that may not know what Legionnaires disease is. It's a type of pneumonia, the Legionella bacteria. It you can get it from ingesting water that's been affected. You can also get it from like the mist, the aerosol of water, and so it's problematic in communal living areas like a nursing home. It can spread like wildfire, my understanding is that it has a much higher fatality rate in healthcare facilities than not for Legionella or Legionnaires.
Like more for the elderly population, you mean? Like, is that
Probably, yeah,
okay?
but I mean that's hugely problematic. So yeah, you should definitely have reported it to your agency, but God, it needs to go to OSHA. It needs to go to the state health department or the county health department, even like the CDC, because I'm pretty sure they're required to have surveillance programs in place for this sort of thing, because it is a known risk in healthcare facilities. So I would like to think that the organization has already reported those things, but we all know that they often don't report things that are required to be reported. So if it were me, I would be documenting it in email form to the chain of command, not just within your agency, but within that nursing home. And you can go online and file, submit reports, even anonymously to OSHA, probably to the CDC as well. I would be doing that because
Is this
ultimately
so that
they're at risk.
that they're taking the appropriate precautions and trying to get them appropriate water, or is this so that if she does become ill, that
Both.
then okay? That's what I'm trying to figure. I mean, I would hope at a minimum they're doing the right things with the water and getting them clean water. I mean, good grief, if they're not even doing that, that would be
Yeah. I mean, clearly their
that
water
sounds
supply has been affected and they're aware of it,
illegal.
but what are they doing? And are they providing other sources of water? And what are they doing as far as isolating, positive patients and whatnot? I mean, that's problematic, right? What do you think, Marla? Do you have any other thoughts?
Well, it is one of the bacteria that we were talking. I didn't say Legionnaires, but it
With
is
the
one of the
toxins, I
bacteria
was
that we worry
wondering
about
when you
for,
said that.
yeah, water contamination, and it is one of the ones that we do worry about. And what we're seeing is that people are drinking the water that they have on hand, and we do have boil water alerts out. But how do you boil water when you don't have a heat source and you're desperate and you don't have any
Right.
water? So we have
Oh my
those
gosh.
trying to get this information out to folks and to get them clean water as fast as we can. But it's not just, just letting your kids play with toys and things like that. Don't let your kids play in flood water. I know that
Mm-hmm.
sounds kind of basic, but I know for us when we were probably young kids, when they would do the fire hydrants, and we'd like to play out the fire hydrants, but I'd see people playing out in flood water and
Mm-hmm.
toys and things like that. You need to clean those things off properly, and
Yes,
that's like
I'm
that.
so glad you're saying that. And okay, so the peds nurse in me, side note, because Kawasaki's disease, like,
Right.
do not let your kids' bathtub toys sit with stagnant water in them.
Oh yeah.
Make
No, no,
sure
no.
that,
Yep.
that those things, you're
You're
getting all the water
boiling
out, you're
them.
letting them
Yeah.
air dry, like
Yep.
that's problematic. Yeah. Be careful.
Have you ever seen what can come out of those things that sit?
Yeah.
Like
Yeah.
if you let a bat, I mean, literally mold and I don't even know. It looks like lettuce that's gone bad. Like it's
You know what's
disgusting.
another one that people don't realize? Stanley cups. You know how you can buy all the cute little lids that cover the straw
Oh
that,
yeah, you
like,
gotta clean them things too.
those things harbor mold and bacteria. Yeah. Like, you should
Sippy
be
cups
emptying
too.
out.
The
Yeah.
sippy
Any
cups that
kind
for
of
kids.
Stanley
Yep.
cup, any of those, you should be emptying those every night and letting them air dry, taking it apart, all of the pieces, the straws,
Yep.
everything that come apart, and letting them air dry. Don't just refill it every day,
Yeah, I was
you
gonna say, do
know?
you know many people just use that same water cup and don't wash it? I
Yes.
mean, you would think it's common sense and that most nurses would, but not always. You get lazy, you leave it in your car. Who knows? Then you grab it and you got to be
Yeah.
careful, guys.
Yeah.
Seriously.
Yeah, I think we're going to see that in great numbers. And the other thing that folks don't realize, we talked about bees, but we'll talk about mosquitoes too. So it's not the mosquitoes right now that happen; it's the mosquitoes in 2 weeks, and so that's when you're going to see more Zika and West Nile
Mm-hmm.
go up. So you have to kind of think about.
Yikes.
You're not just thinking about the right now, but you're thinking about 1 week out, 2 weeks out, what you're going to see and what you need to anticipate. So when
That's
you're
a good
sourcing
point.
all the medications and things we need like that, I mean, that is part of my skill set, is that project management and thinking ahead and being prepared for everything. People always say I always drive around with my nurse mobile. It's true. It's true. It's a
Doing your
condition.
community
It's a condition.
assessments from the car.
It's a condition. I admit it. Yeah, but I love project management. I love that piece of it. So anything like that we can do for boots on the ground to do some coordination from here. And you need a place that can stage. And we have the facilities, we have the infrastructure to do that. And then we have our convoys that are regularly going in.
Okay, so let's talk about convoys and supplies needed. Um, did you guys see where Walmart sent a convoy of something like 60 huge tractor trailers full of supplies into the affected area, which I thought, first of all, I was shocked and appalled because Walmart are normally cheap ass bastards, right? So the fact that Walmart, right? So the fact that
Damn,
Walmart is
Walmart.
stepping up and doing that, like, kudos to them. Like, police
Yeah,
escort
that's
convoy
great.
of all the supplies. But I want to know, what are the hospitals doing? Are there any in there, like the HCAs? I did hear something good about Doctors Hospital, which I think is HCA, that maybe they're stepping up and getting like gasoline for employees and stuff. But these huge healthcare organizations in these affected areas, they need to be putting their money where their mouth is right now and doing their part.
Yeah. You guys are familiar with one of my besties that's out in California who's a skilled hiker. She was there with us for the Nurses March. But skilled hiker, ICU nurse, in shape, right? Can do all the things. So we talked about her coming in and going in with us. But I said to her, you need to, let's see if we can get you sponsored by your healthcare facility. They
Mm-hmm.
can afford it. She doesn't need
Yep.
to lose money to come. She
Yep.
doesn't need to, so we always ask of us, right? So we're kind of the first to jump in, but the larger organizations don't necessarily do it. They don't support our efforts to do it. And I even look at this because we have nurses who don't have the nursing license, like they're already newly retired or expired licenses. So they're all
Mm-hmm.
covered under this emergency order that Governor Cooper did with the Board of Nursing. So that's all been issued. But I always think it's always the volunteers that kind of step forward, but we could really use help from the infrastructure. So I will tell you, Duke Hospital sent their contingents of nurses.
Good.
Atrium Health, which was Carolina's healthcare out of the Charlotte area, they sent nurses. And so I do believe that HCA had something, it is their main hospital that's been affected.
Mm-hmm.
Mission is the largest
Mm-hmm.
employer of healthcare for that area. So, I think that they are doing something internally for those nurses that they could register with them and do some sort of cycle through like a temporary travel nurse type thing, but within their own organization.
Okay, but even outside of the nurses, like supplies, they should be donating a ton of money and or supplies right now, right? I think.
They
When was the
should
last time
be.
you saw that? Yeah. I'm having better luck with the smaller companies. I just did a reality check for a second.
So Marla, tell us about your thoughts on maybe like the government, what they can or should or are not doing, and military. What do you think? Because
I
there's been a
think
lot
that
of
we
talk
all
around that.
in
Yeah, there
social
has
media
been.
world that we need to understand that there's a lot of misinformation. We're inundated with bots, scammers, lots of scammers. So there's a lot of disinformation happening. So I would suggest for folks to follow actual things that the volunteer organization assistance with the disaster, they have their own Facebook page. So follow them if you want to know what's happening with all these different organizations that are reporting in, because that's up-to-date information that's accurate. Same thing with Wilmington Response. Beloved Asheville. Some of these really, folks that are, give you good information that's accurate and timely. So kind of just thinking that this is a fluid situation, very dynamic. So folks expect that all this infrastructure and planning, and it does happen. They don't necessarily show all the things that are happening at these emergency operations center and command centers, but it's happening. And we don't have necessarily a lot of time to reply to stuff that's happening in social media world. So you have a lot of negativity. It's not true. You just have to consider that a huge amount of that is not true, especially when folks politicize the whole situation. FEMA's not taking, money out of your pocket. They're not out there on the road, taking your supplies and confiscating them or selling them out or doing all. Now, when I say that you need to register, not self-deploy, that's no joke. So you actually do need to do that. For all intents and purposes, the roads are closed. So even us, we had to register. We had to say which people were in our party, where we were going to, what we were going to be doing, and we had a police escort. That's the way to do it. So if you want to help, that's fine, but you need to kind of get with one of the organizations that's already got all that built into it. My son Luke is part of the military. He's with the National Guard, and he's just deployed to Jordan. And this is his second deployment in under a year, because he was there in Poland at the border of Ukraine for that issue as well. So I've seen a lot of things that are triggering for me online that bother me, because they'll say, why are you sending all this money to Ukraine? And why, look, he's part of the military. The military is there, but also he does stateside missions as well. And the National Guard is here. So we already have 1,100 National Guardsmen that have responded to Western North Carolina. And we're also very near to Fort Bragg, which is now Fort Liberty. And we already have a federal response of another 1,000 soldiers that are coming for that. So, and plus we have National Guards from all over surrounding states that are sending us help. So we need engineers, and so we have like Army Corps of Engineers, we have helicopter pilots, things like that. We have everybody coming. It's not that they aren't there and that they can't be a rapid response network, but and we know that it's neighbor to neighbor at the very beginning. And when you take out the town hall or you take out, where, you have to stage and get these emergency operations up in different places. And when you knock out communications, it takes a while.
Yeah.
So I think for folks who are used to being in areas of natural disaster zones, you kind of get used to, for a minute, you're going to be on your own. And when it's really bad, and if you think all the way back to Katrina, I mean, people were trapped for a long time. And even then, if you remember, they would take spray paint and they would go house to house. If there was a house still there, and they would tell you, they had a grid and they would tell you if there were people missing, people inside, people, whatever. It would tell you that we're going to be doing those kinds of things too. This is not a new situation. It is really how we handle emergencies in the United States. And the military does know what it's doing. FEMA does know what it's doing. But this was multiple states that were hit.
Yeah.
Yeah.
There's only so much of us to go around. And when you knock out every road, what are you supposed to do? You have only so many helicopters. I mean, it's government plus volunteer organizations plus individuals. And we all have to do our part for this.
Yeah. Yeah, I know there's been a lot of concern about, conspiracy theories, or I don't know. I haven't gotten that much into it about FEMA or the American Red Cross, and people didn't feel comfortable donating and all of that. And, I don't, like I said, I don't know enough about that. But what I did do is I went to some of the boards of nursing, because of course we're always thinking about the nurses that are affected. And I will say that North Carolina and Tennessee do have things in place. And of course, we'll link it in the show notes. But ncnurses.org for North Carolina, they actually have a North Carolina Foundation for Nursing, which is a 501c3. It's a nonprofit. And that they had already in place. They kind of revived it for this. They have a nurse recovery fund. They are distributing directly to nurses suffering loss or damages. And the North Carolina Nurses Association is donating all of the staff time needed to administer the funds and donations. So that to me looks very reputable. And the Tennessee Board of Nursing, and it is not easy for me to say anything positive about the Tennessee Board of Nursing. This is not easy. If you know, you know. But tn.gov, they have a whole banner on the top of their website. You can go to donation centers. You can donate items. You can donate funds. They have disaster relief hotlines. And they did have a good list of supplies that some of the things were surprising to me, the supplies, because I think everyone thinks of like bottled water, non-perishable food, first aid items, stuff like that. But, things like flashlights, batteries, trash bags, gloves, charcoal, propane, candles, dog and cat food, shovels, gas cans, personal hygiene products, Tylenol, Motrin, that kind of stuff that would not have occurred to me. So, if you can donate, if you can volunteer, please do. Yeah. I know Jessica.
Yeah, I was just say, to put it into perspective, like even here, you cannot, this is 3 days out. You can't find water anymore. There's no bottled water, no jugs of water. It's all sold out. All the batteries are gone. I mean, you can't, it's just, people, especially with the storm just had us hit and the severity, like people are seriously in panic mode. The lines of the gas stations are wrapped out onto the main roads. Like it's serious. So, and then the storm hits and you can't get the supplies in like you normally would. So yeah, I would say, and there's no electricity. Batteries are huge. Batteries, flashlights, anything like that is a huge saver there.
And we've been doing asking for the minor lights as
Oh,
Mhm.
well.
that's a good
So
idea.
those
Yeah, like
are
the ones
Keeping
you
those are
your
wear
really
on your
hands
important.
head.
free.
Hmm.
See, I would
Yeah,
not
Those
have
that's
are
thought of
important.
that either. That's a good idea.
So we have an Amazon wish list as well because of
Okay.
that. And so I don't want to forget the baby formula and diapers. That's
yes.
Oh,
been a
yes.
huge request as
That's a
well.
good one too.
So,
Yeah.
and we just had a dire one we just finished up, and I know that we needed can openers because a lot of people donated
Mm.
canned food, so
Another
we didn't
good
have enough can
point. See,
openers.
would not have
Yeah.
thought of that either. This week's Enema Award is sponsored by Happy Bum Co. They are the leader in natural at-home detox solutions. Their mission is to shine a light on the taboo topics of gut health and remove the fear and stigma that commonly surrounds using enemas.
Many Happy Bum customers have reported feelings of decreasing their period pain, sleeping better, having clearer skin, less sugar cravings, increased energy, and an overall sense of just well being.
And don't forget the most important, instant gut relief.
Yes, that's very important. You can go to happybumco.com to order your first bundle or as many bundles as you'd like and use code Nurses Uncorked for 15% off. Erica, who do we have the pleasure of giving an enema away to this week?
Yeah, you guys aren't going to believe this one. There is a hospital in southeastern Pennsylvania. That's all I can tell you for now. They have metal detectors, but only in the ED. And as you can imagine, the employees have been asking for metal detectors at all of the entrances. But get this, their gift shop, which was recently revamped, has now recently started selling pocket knives in the gift shop
What?
of the hospital
Why?
that doesn't even have enough and even if they did have metal detectors at every entrance, it doesn't matter because they're buying it in the hospital once they're already inside. They have reported this to administration and crickets. They have heard absolutely no response. Please tell me what possible reason a visitor in a hospital would need to pick up a pocket knife
Wait, so
in
if
the
your
gift
shank
shop.
weapon gets taken away from you, you can get a new
Yeah.
shank weapon at the gift shop. Isn't that's kind? That is so thoughtful of them. And
In this
okay, I
day
could
and
see if they
age of healthcare worker violence, right? Let's just give them the weapons to make it easier, past the metal detectors, no less. Yeah.
well,
So this week's Enema of the Week award goes to you. There's no excuse.
keep your friends close and your enemas closer.
So Marla, have there been, if you had to pick maybe one or two just like really kind of horror stories that you've heard out of this recently, is there anything that comes to mind? I mean, you really got me with the bodies floating by. I had heard about that, and the EpiPens and the bees. That would not have occurred to me. Anything else that you think people really aren't seeing or hearing about? Well, and the 1,000 body bags. Goodness.
So yes, when I had a conversation the other night with North Carolina Task Force 11, one of their members, it was actually one of their other team that hadn't deployed. And when I was calling him and asking him, he runs an IV hydration clinic, and so I was asking him for IV supplies, and he's like, "I just sent everything I had with firefighters out." So I told him, we were ready to leave the next morning. And he said, Tyvek suits, get the Tyvek suits. And then he said, are you guys ready for the mental health phase of this? Because the guys that came
That's
back,
coming.
the 13 that came back, the first group that was there, he said, we're all critical care type brains,
Yeah.
and we're used to a lot of this stuff in there too. He said they're messed up. They're going to need major mental health support.
Yeah.
And so that is going to be a phase of kind of the walking wounded, and that, everybody kind of glazed over, and that, you're going to have a huge mental health
Yeah.
So anyway, the pictures of the dead bodies and things like that, of how they found those little kids and things like that.
Oh,
And I don't want to get graphic on here, but
Yeah.
yeah, they're not
breaks my heart.
okay. They're not okay. And, they left a lot of the bodies lie because they had to.
Because it's still a search and recovery mission, right?
Right.
And I know,
it's so hard to
Jessica, you were.
I feel like folks really need to wrap their head around that this is our Katrina and this is our Hurricane Maria.
I think that's
like
a good
if I
point.
really had to sum it up, and if you remember all that coverage and how we were all spellbound with Katrina for so long during that, and it is disheartening to me to see the lack of coverage that we're getting. So I appreciate being able to speak directly to nurses here. We say North Carolina strong, and we are North Carolina strong.
Yeah.
So thanks for having me.
And an open invitation to any nurses, medical professionals in the affected areas that would like to share their story. Just reach out to us.
Yeah, I hope everything is safe for you all.
And thank you for all the good work that you're doing out there.
Yes. Yes, you rock. You're always one to volunteer and get right in there, and that shows what an amazing person you are. I love you, Marla.
I love
Thank
you guys too. Thanks so much.
All right, until next time on the next Nurses Uncorked.